The information presented in this program is for educational purposes only. It is not intended to diagnose, treat, or cure any condition, illness, or disease. The depiction of successful results from the treatments discussed in this presentation are examples of the possible benefits and do not guarantee results. The decision to start any medical treatment should be made only after discussing all benefits and risks with a healthcare provider.
Welcome to Healthy Dose with Dr. Joe. Are you ready to repair damage to your body? Replace what is depleting to regain your youthful vitality? Regenerate what is now degenerating? Dr. Joseph Gambardella is a doctor of chiropractic medicine and an anti-aging health practitioner diplomat. He was the first doctor in Miami to complete his fellowship training in stem cell therapies. As the owner of Advanced Physical Medicine and Rehab of Miami, he provides patients with the most sophisticated and safest treatments in the market today. Join Dr. Joe for the next half hour and learn about the medical advancements that have helped thousands avoid surgery and pain meds. From stem cells to hormones and everything in between. Get ready to feel empowered. Get ready to regain control and reclaim your life. Now, here's your Healthy Dose with Dr. Joe.
And welcome to another Healthy Dose podcast. I'm your host, Dr. Joe Gambardella with Advanced Physical Medicine and Rehab of Miami, and also with Miami Disc Center. You can follow us at apmrmiami.com and also check out our new website, miamidisccenter.com. Tonight we're going to be talking about lower back pain. 80% of adults at some point in their life are going to experience back pain. It's the most common cause of job-related disability and a leading contributor to missed days of work. More than a quarter of the people out there listening are going to experience lower back pain of a significant degree within the next 3 months. So this is a really trendy topic, especially now that we're approaching the holidays. One of the things that we always talk about in regard to any type of pain is the reason why we treat patients, which is to help get them healthy and to help their body to heal again without the use of drugs and without the use of surgery. It's the most important thing that we talk about. So one of the first takeaways of today is there are ways to get the body healthy again and to minimize the effects of drugs and the negative effects that they'll have on your health overall. A lot of people have back pain and they simply attend to it or manage it by neglecting it, ignoring it, or pushing through it. The goal that we have for all of you out there listening today is, number one, you got to get out of pain. You got to reduce the amount of pain that you're having, but you have to do it safely and effectively. And the second thing is you have to improve your performance. You got to improve the ability to do things, be with your family, work, vacation, without being in pain. That's what our goal is. All of you listening out there, what's your goal? A lot of you have been discouraged because you have this back pain. You're falling into the percentage of the 80% that do have back pain, and you haven't been able to overcome it on your own. That's going to stop tonight. We're going to talk to you about back pain, how to identify what your source of back pain is, where it's coming from, and how to fix it once and for all. So the first question that you have to ask yourself is your back healthy? First, most important question. The answer to that question lies within this statistic. If you're suffering with back pain, you have inflammation. Inflammation or chronic inflammation is pain that has lasted longer than 3 months. If you've had pain that's lasted longer than 3 months, it's indicative of a degenerative condition. And as you remember from our previous podcasts, degenerative conditions don't get better by themselves. You have to do something about it. The second question that you have to ask yourself is the degenerative condition affecting soft tissue or hard tissue? And specifically talking about the lower back joint is made up of specifically bones and discs which cushion the bones and allow for movement. All of those structures protect the spinal cord and the spinal nerves that sit behind them. So the degeneration that affects the lower back, if it affects the bones, it's called arthritis. And when spinal bones degenerate or form arthritis, they actually grow in size. And unfortunately, when these bones grow in size, they grow toward the nerve and toward the spinal cord, resulting in conditions like stenosis, herniation, bulging, and desiccation. And we'll later on in the episode identify and describe all of those in detail. The second type of degeneration that affects the lower back, it's the most significant and the most neglected, least treated, is degeneration that affects the spinal disc. When the spinal disc is injured, it actually gets smaller or decreases in size. And it's a two-part injury. When the disc is injured from trauma, most commonly from bending forward, twisting, most patients feel instantaneous pain. But what I want to let all of you out there listening know is that this is an injury that builds over time, but the symptom shows up suddenly. So let's in your mind's eye, I want you to visualize a jelly donut or a sunny side up egg. The soft part of the yolk represents the disc. The jelly inside of a donut represents the disc. I want you to visualize squeezing that jelly donut, squeezing it, taking a really big bite of it, and having the fluid shoot out the side. That's what happens when your disc in your lower back herniates. You could be putting pressure on that disc for weeks, for months, or years before it ever herniates. The interesting thing is, most of the time you only feel the pain when the disc fully tears or herniates. So how do you identify if you're at risk, low risk, medium risk, or high risk for having this type of condition? The most important thing to do is, as soon as you feel any type of discomfort or pain that affects the lower back, get it checked. The number one rule, get it checked and find out if there's an injury to the disc. And who do you go to? The best type of physician to see when you have back pain initially is a chiropractor. Why? Because chiropractors dedicate their entire profession, their entire careers toward treating and evaluating lower back injuries. It's one of their primary focuses. It's what we do here at Advanced Physical Medicine and Rehab every day. We help people who have lower back pain, and we actually help control and contain these problems so that people could live normal lives. How do you identify if you have low risk, medium risk, or high risk low back pain? You get evaluated and you take an x-ray. The x-rays are diagnostic for several types of degeneration, and they will immediately let us know if the bones are affected or if you have arthritis, number one. Number two, you need an MRI. The MRI is going to tell us about the health of the disc. So let's talk about the disc for a moment. The disc is the shock absorber that allows you to bend over, tie your shoes, go up and down stairs. It allows for all movement of the spine. There's three types of injuries that are identified in an MRI that affect the disc. The number one thing that we'll see in an MRI is called a disc bulge. A disc bulge, think of a triangle, and you have three sides of the triangle. On the top of the triangle, you have a disc bulge. Disc bulges are exactly that. The disc is put under pressure, and it changes its normal position, and it bulges back toward the nerve. A disc bulge can cause significant amounts of pain, but it is treated almost 100% of the time non-surgically. When you have a disc bulge for a long enough period of time and you have enough stress and enough unhealthy habits that build up, eventually that bulge is going to turn into a tear. The outer layer of the disc will tear and fluid will escape from the disc and leak out onto the nerve. That's the second side of the triangle. That is called a herniation. Herniations are significant problems. Most are still treated without surgery very safely and very effectively if you do the correct treatment. The third side of the triangle that we'll talk about is something called disc desiccation. And a desiccated disc is a dried out disc. The best analogy I can give you of what a dried out disc looks like, feels like, is a sponge that does not have water in it. If you take a sponge that doesn't have water in it, it gets hard, and oftentimes it'll get brittle. If you squeeze it, it may snap in half. When discs become desiccated, they provide no shock absorption and make arthritic conditions significantly worse. If you're out there and you're listening and you wake up in the morning stiff, it takes minutes or hours to loosen up throughout the day, you may have a desiccated disc. The more dried out that disc becomes and the more advanced the arthritis becomes, the more limited your life activities will become. Everyone listening, keep this in mind. These conditions are degenerative. Bulge discs turn into herniations. Herniations will become desiccated. All of these conditions result in significantly impaired activities, like playing with your kids. Forget about doing the sports that you like to do. And the worst part about it is they're often treated non-surgically, safely, effectively, and they don't cause any pain to get treated. That's really what we've dedicated our practice to at Miami Disc Center. You can follow us at miamidisccenter.com. Non-surgical spinal decompression. When you have these disc injuries, it is of the utmost importance to get them treated correctly. All of our research on treating these disc injuries is based on scientific studies that have been published and researched at Harvard University, Stanford University. The specific tables that we use are called intersegmental or interdiscal decompression tables. It is completely different than doing spinal traction. Lying on inversion tables, flipping upside down, may give you some relief, but for a herniated disc, a desiccated disc, it will give absolutely no long-term significant change and does not stop degeneration. The tables that we use, as published in many, many studies, specifically the John Leslie study out of the Mayo Clinic, yield success rates of up to 80 to 90% of patients that have had back pain for an average of 10 years. Patients that underwent treatment with our specific type of technique, keep in mind, 10 years of back pain and limitations. Upon completion of a 6-week protocol, the success rate was 88.9% documented. That's what we base our treatment and our therapy on. So when you have these types of disc injuries, the thing that you want to understand is that every tissue in your body requires oxygen to heal. We've spoken in the past about stem cells. We've spoken about knees. We've spoken about hips and shoulders. Every part of your body has some blood supply to it. The more blood supply that you have, the faster you're going to heal. So I want you to think about bodybuilding and working out. When you go to the gym and you work out, you get sore. You're actually tearing down muscle fibers and you get the pump. Your muscles get really full, they get tight, and you can actually see the muscle grow in size. The reason why you're able to go back to the gym in 3 to 4 days and train the exact same body part again is because that pump is blood carrying oxygen. Here's the second takeaway. When you tear tissue and you expose it to lots of oxygen, you heal really, really quickly. And you heal stronger and better than you were before. The tissue in your body that has the weakest blood supply in the entire body is your spinal disc. It has almost no significant blood supply. So what does that mean? When you tear the outer fiber of the disc, it does not get exposed to large amounts of oxygen, so it never heals. So you're sitting with a tear in the back of the disc that all you have to do is put stress on the body, whether it's coughing, sneezing, bending down to tie your shoe, doing the wrong move at the gym, and all of a sudden, all of this fluid starts to leak out the back of that tear and sit on the nerve. And then the pain gets worse and gets worse and gets worse. Treating these conditions with anything but spinal decompression is not going to give you the result that you're looking for. Even worse, the problem will continue to degenerate over time. One of the worst things that people do is they over-medicate for these conditions that are non-surgical. I want to make a clear distinction of what we're talking about tonight between surgical cases and non-surgical cases. 90% or more of these cases are going to be non-surgical. A surgical case is one where you've lost control of certain body parts, your foot drops, you've lost control of bladder and bowel function. These are absolute medical emergencies and have to be treated by surgery. How many of you out there listening tonight have had that happen? I'd say almost every single one listening has not had that happen, which means most of you who have back pain are going to be able to be treated successfully. So in this treatment of non-surgical spinal decompression, there's 2 things to consider. Number 1, when you have a bulged disc, a herniated disc, and you have fluid sitting on a nerve, the first thing that we want to do is control the problem. By putting you up on a spinal decompression table, a specific type of a table, at essentially 30% of your body weight, if you have a lower back disc herniation, we're going to safely, gently decompress or pull apart the segments surrounding the herniated disc. And what you're going to notice gradually over time is that fluid is going to come off the nerve. You're going to start to feel great. That's first part of the treatment. The second part of the treatment is getting that disc to scab up essentially and heal so that the fluid never comes out again. Think about this. When you fall down, running outside, you skin your knee, what happens? You form a scab. Once the scab falls off, you have new skin underneath, the blood is contained, and your body has healed. And it's healed until you fall again or forever if you don't injure it again. With these spinal discs, if you're able to expose that disc to enough oxygen, the same thing is going to happen. So the second part of the therapy is laser therapy. There's all different types of lasers that we use here in the office, depending on if you have a herniation, if you have desiccation, or if you have a bulge. 3 different types of lasers for each one of these conditions. Why is a laser so important when you have a disc herniation? I'm going to tell you why. It's because lasers will allow blood vessels close by to the disc to rapidly expand. And they're going to start to push large amounts of oxygen around that tissue where you have the herniated disc. Once your body is able to absorb enough of this oxygen, your body will form a scab. It's called cicatrization. It's a scab that forms on the backside of the disc. It contains the fluid from leaking out again. When you continue to expose the back of that disc to enough oxygen, eventually that scab will heal and the fluid will be contained within the disc. Pre and post MRI studies show increases in size of the discs and significant decreases in pain. The best part about it, most people fall asleep during the treatment. When this therapy is completed, like any other system of the body, maintenance is absolutely required. The older you get, the more maintenance is required. For every system in the body, there's 11 major organ systems of the body. You have the cardiovascular system. Does that require maintenance? Absolutely. You have to exercise to maintain the cardiovascular system. You have the circulatory system, the blood system. If you don't eat right and you become diabetic, your circulatory system is going to suffer. If you don't push enough oxygen to parts of your body, they're going to start to degenerate. You have the integumentary system, which is the system of your hair, skin, and nails. If you don't protect your skin using sunblock, if you don't protect your hair, all of these things become damaged over time. The musculoskeletal system is the exact same thing, but it's the system of the body that receives the least maintenance over the course of most people's lives. I can tell you this, with the average lifespan expanding significantly from 60 to 70 to 80, 90, and now very commonly to 100, 90 to 100, people are going to live longer, but if you don't have healthy function, you're not going to have good quality. In order to have healthy joints at age 70, 80, and 90 and beyond, you have to maintain the skeletal system. The musculoskeletal system is a system that works together. When you're doing Pilates, when you're doing yoga, when you're doing stretching, you are working on the muscular system. If you have not seen a chiropractor to look at your alignment, you have not addressed your skeletal system properly. You have not addressed it enough. When we come back from after the break, I'm going to tell you the 3 most important things to look for when you find a chiropractor near you. And we'll be right back after this.
Repair your body, replace your key hormone levels, allow your body to regenerate itself without surgery or meds. When it comes to your health, the best plan is preventative. If you wait for symptoms to show, you could be too late. With over 40 years of combined clinical experience, all under one conveniently located state-of-the-art facility, Dr. Joe is on the leading edge of regenerative and physical medicine. Take control of your health and get a free consultation and evaluation. Visit us at apmrmiami.com or call 305-598-8788. 305-598-8788. 305-598-8788.
And we're back. So the 3 most important things to look for when finding a chiropractor near you. Number 1, make sure that your chiropractor has the ability to take an x-ray. The only way to find out if you have an injury that qualifies for non-surgical spinal decompression is to have an x-ray. Number 2 is make sure that your chiropractor works with a center that does MRIs. MRIs are affordable studies that can be handled, and most people can get them even if you don't have insurance. For example, in our office, we're able to send people out to the best MRI center here in Miami that has the best radiologist to get all the information that we need to treat you for $300. Absolutely amazing for the best radiologist here in Miami. And number 3, make sure you find a chiropractor that is certified in non-surgical spinal decompression. All of those 3 things are going to ensure that you have the best possible outcome in treating your lower back. We hold 2 certifications, national certifications in treating these types of disc injuries, and that's why our results speak for themselves. Remember, MiamiDiscCenter.com is where you can find all the information about our services, about the tables that we use, and the lasers that we use to treat the disc from the inside and also from the outside. The average patient that comes to see us, it's really non-age specific. We treat people who are 20, 30, 40, 50, all the way up to their 80s and 90s and beyond with these same types of injuries. The best part about it, there's a beginning and an end to treatment. Over 90+% of our patients within 8 weeks are going to be completely done with their therapy and treatment. Within the first 4 weeks, most people are back to their normal everyday activities of daily life. And again, the best part is non-drug, non-surgical. Just to touch on a couple of things, the most common drug used to treat lower back pain is non-steroidal anti-inflammatories, common ibuprofen, all different types of names for these, both for, over-the-counter and prescription, meloxicam, Mobic, diclonifenac, Voltaren, Advil, Motrin. All of these are non-steroidal anti-inflammatory drugs. These drugs, and in addition to the most common invasive procedure used to treat lower back pain, are epidurals and nerve blocks. At times, these are absolutely necessary, but a majority of times, people seeking these types of treatments can eliminate significantly their problems non-invasively. Those procedures that involve epidurals and nerve blocks are not even approved by the FDA to treat lower back pain, but they're commonly used. So the treatment that we utilize here at Advanced Physical Medicine and Rehab, non-surgical spinal decompression, typically a 6 to 8 week program based upon the type of injury that you have. Again, whether it's a disc bulge, a disc herniation, or disc desiccation, completely treated within 8 weeks total. Average laser treatment time is about 5 minutes. Average length of decompression ranges between 12 to 30 minutes. Every single person that comes in for this type of treatment is well within their treatment time, completing their treatment time within 30 to 45 minutes. So it fits within your schedule. You don't have to stop working to do this procedure, and you don't have to take time off from doing the things that you love to do. What are some of the most common supplements that you can take to help speed your recovery? 2 things. Number 1, fish oils. A combination of EPA, DHA, about 3 grams of good quality fish oils will help reduce inflammation systemically and will help decrease inflammation around the disc and speed the recovery. We also have an amazing product here that we use in the office called NutriDisc, and it is an anti-inflammatory product over the counter that is not non-steroidal in nature. It does not slow your body from healing. There are no toxic effects on the kidneys or the liver. You can take this as you're doing your therapy to get the disc to heal from the inside as well as the outside. These types of injuries you should not be afraid of them, but you need to get them diagnosed correctly. Again, 80% of people suffer with lower back pain at some point in their life. Those listening out there tonight, within the next 3 months, 25% of you are going to be infected in a significant way with lower back pain. The most important thing to do when you have lower back pain is don't minimize it, don't ignore it. Get it evaluated, get it treated. You can't afford not to. We're coming up to the holidays. People are getting close to thinking about their New Year's resolutions. We're coming in towards Thanksgiving and Christmas. The best thing that you can give yourself is the gift of health. At Advanced Physical Medicine and Rehab.com, we are located in Miami, Florida. 7170 Southwest 117th Avenue is our address. Our phone number is 305-598-8788. Everyone that hears us tonight that calls and mentions that you heard our podcast, we have a special offer for you regarding your lower back pain. Call the office and find out exactly what that is. I want you to look at our YouTube webpage listed below. You're going to see the link below for more information. And also check out our website, MiamiDiscCenter.com. You can request our free report, our free booklet on how to treat lower back pain, how to do it safely, how to do it effectively. I'm Dr. Joe Gambardella. I can't wait to talk to you next time. We're going to be talking about different ways to keep yourself healthy and 3 ways to ensure that you meet your New Year's goal of losing 20 pounds by the end of January. We'll see you next time.